Today we will learn about what makes WartPEEL so unique and why, although it's produced in a compounding pharmacy, is much more advanced than your typical compounded formula, which is simply a mixture of active ingredients in a pre-manufactured base. To start with, WartPEEL has 3 U.S. patents. It went through a unique development process that typical compounding medicines do not go through. Medcara Pharmaceuticals, which developed WartPEEL, has exclusively licensed it to be compounded and distributed by its sister company, Nucara Pharmacy. If you ever see any look-alike or sound-alike products on a compounded list and they're not from Nucara Pharmacy, it's not WartPEEL. It also has a long history. 12,000 providers to date have prescribed it, and you even may know someone who's using it right now. WartPEEL is exclusively licensed to be produced at Nucara Pharmacy, which has 20 full-service pharmacies, many of them specializing in compounding. When most people think about a compounding lab, they think about a section of an independent pharmacy, which, unless they have a very large compounding business, does not have a full-time compounding staff and has people multitasking between compounding and retail pharmacy. Since Nucara has such a large compounding business, they have several full-time compounding facilities with dedicated staff. They have 9 areas of specialization, and they operate in 48 states, so they have a lot of prescribers around the nation. Being licensed in 48 states also means that they must meet the most stringent state requirement that they're licensed in. They adhere to the highest standards in the nation. They are accredited by not 1 but 2 compounding associations, and they are one of the most well-known and respected compounding pharmacies in the nation. Due to new laws and regulations in 2014, compounding became a more highly regulated business. This forced many of the smaller compounders out of business. Here are some pictures of Nucara Pharmacy's state-of-the-art compounding labs. Because WartPEEL has 5-fluorouracil in it, it has to be produced under the strict rules of the USP 800 guidelines for hazardous substances. This requires sterile conditions and tight environmental controls. The way WartPEEL was developed is a very interesting story and revolves around the unique relationship between Medcara Pharmaceuticals, Nucara Pharmacy, and the providers that they work with. Keep in mind that compounding is at the core of Nucara Pharmacy's business. This requires very close collaboration with their provider base. They actually have pharmacists whose main job is working with providers to develop new compounded medications. In 2000, one of those Nucara pharmacists got an idea about compounding 5-fluorouracil and salicylic acid at a conference. He brought this idea to podiatrists who were excited about the potential of this combination of medicines to treat plantar warts. Several prototypes were developed that showed promise. At this point, Medcara became involved because Medcara specializes in drug formulation and has a full-time pharmacist whose job is to either create new compounded formulas or to take existing compounded formulas and to refine and perfect them. Medcara performed multiple reformulations and extensive testing with their provider base, and then this is how today's version of WartPEEL was developed. By 2004, it was obvious that WartPEEL was highly efficacious and the sales were increasing. Medcara decided to investigate what it would take to get WartPEEL FDA approved. They had the patents, it already contained 2 drugs which were FDA approved, and there was no other drug that was approved for the treatment of verruca vulgaris besides salicylic acid. They applied for and were granted a pre-IND meeting where the FDA would give them guidance about what to expect during the drug approval process. IND stands for Investigational New Drug. The costs were higher than Medcara thought. Because the drug had 2 active ingredients, multiple study arms would be needed, and the FDA estimated price tag of $50 million. The FDA would also not give them clear guidance as to whether they could sell WartPEEL as a compounded drug while they were doing the studies. When Medcara approached investors or drug companies about fundings, they found out that they considered warts to be a small market, and that drug companies and investors were looking to invest in something to treat a chronic condition rather than a medicine which is just used once. As sales continued to improve, Medcara decided to keep WartPEEL as a compounded medication and not seek FDA approval. WartPEEL is a compounded medicine like a shark is a fish. A shark is definitely a fish, but it's very different. One of the first ways it's different that we talked about is it has a remedium sustained release gel, which is protected by 3 patents. And while any compounding pharmacy could put salicylic acid and 5-fluorouracil in a pre-manufactured base, it's not going to work the same as WartPEEL. And WartPEEL is a collaboration between pharmacists, expert formulators, and physicians. It's $95 and a self-pay product because it's a compounded medicine. We do have a patient assistance program, so if your patients are having trouble affording it, please let us know. That concludes our presentation. At Medcara, we believe in standing behind our product and supporting our prescribers to get the best possible results from WartPEEL. That's why I'm available to answer questions, to go over cases by phone, text, or email, and I'll respond the same day or the next business day. I can also do a virtual presentation for your office or professional organization. And don't forget about all the educational resources at WartPEEL.com. I'm Steve Leon, Physician Assistant, Clinical Consultant for Medcara and WartPEEL. Thank you for listening.